My name is Christian Gausvik, and I'm a primary care physician with the Christ Hospital Health Network focused on LGBTQ health. I think there's three big things that the LGBTQ community faces in healthcare, and that is trust, communication, and access. Trust, communication, access. Patients have to be able to trust their physicians to talk to them about things that matter, to share with them about their sexual practices, about their lifestyle, so that they can make good, informed healthcare decisions. That ties directly in with communication, so being able to communicate openly with your primary care physician, I think, is super important. And when that breaks down is when we lead to issues with access. So around 50% of the LGBTQ community has deferred healthcare at some point due to concerns about discrimination, and only about 16% of patients have shared their sexual orientation with their physician. And I think both of those numbers really point to the fact that there are huge disparities between the general population and the LGBTQ community in healthcare. Finding an LGBTQ-friendly provider can be challenging, and I think often prevents folks from seeking primary care. There are a few good resources, so certainly word of mouth, talking to your friends, using Google. Outcarehealth.org keeps a directory listing of physicians who have chosen to place themselves in the directory, and so you can be sure that seeing doctors from that list, you're going to be met with a friendly face. But in all honesty, there's a great shortage of members of the LGBTQ community serving in these roles, but there are lots of great physicians out there providing amazing care to our community. Given that almost half of the LGBTQ community has faced discrimination in a healthcare setting in the past and has now deferred healthcare because of that experience, I think the most important thing that we can do to increase healthcare access for the LGBTQ community is to ensure that physicians out there that are welcoming and willing to talk about these topics are vocal about that, and make sure that the community knows that they're there, willing to listen, and accept their trust.